Hi, my name's Carolyn Evans. I've been an RN since 2019. I graduated from the RNEC program at UACCM at the time. I worked in an intermediate care setting for a while. I swapped to home health, and I currently work in the hospital at UAMS as a neuro ICU nurse. A quirky fact about myself, I am a crazy cat lady, and I have 3 fur babies that I love very much. Um, Social determinants of health, all 5 are very important and they all kind of intertwine. Um, the biggest one to me though is education, because if you come in and you're sick and you don't understand why you're sick, how can you get better? A lot of times, and the education level of our patients may not understand the terminology that we're using, and they lose a lot of what we teach them. And so whenever they go home, they go back to their old ways, and they don't change their diet, they don't take care of themselves, and they think that everything's going to be hunky-dory. Another social determinant that's very important is the poverty level that you're at. If you live in a low income area, a lot of times the clinics around there are not going to have the things that you need. If you have a disease that needs special treatment, you might not always get what you need because you can't afford it, or it's just not available in your area. For that reason, if that could be fixed, a lot of people would be able to take care of themselves a lot better. But medicine costs money, and not everybody has it, especially in low income areas. Also, language. If somebody comes in and they don't speak English, a lot of times it's very important that even though you think they understand what you're saying, if you know a little bit of Spanish or Portuguese or whatever they come in with, they don't always understand you, and sometimes they think that you said something that you really didn't. It's very important to follow up with that, and it can make a difference of life and death even. The reason why I'm taking this class, I need to get my BSN because I want to become an APN or a CRNA. I would like to further my education, and I want to get as much out of the assessments and things that we look at as a person completely to do the best that I can for the patients that I have. It's nice to meet you all.